This is Valerie VanBooven with the Senior Care Industry Netcast, where leaders with 3 or more years in the senior care industry share their advice. So let's get to it. In a few sentences, tell us who you are and what you do.
Yes, hi Valerie. I'm Karl Sauereisen, and generally I'm an executive, entrepreneur, and consultant. But one of my roles is to serve as president of Hope Extended Care Services. Hope is a team of healthcare providers that provides care on a daily basis for patients of skilled nursing facilities. We primarily employ nurse practitioners to manage the chronic health conditions of nursing home residents. And our geographic niche covers Western Pennsylvania, mainly in rural areas where there isn't as much of a physician presence and the senior population is somewhat underserved.
That is really neat. So tell me a little bit more. So the nurse practitioners go out to these rural areas or to any nursing home in Western Pennsylvania that they're contracted with. And instead of relying on just a physician to make those rounds, a nurse practitioner is there to oversee some of that in collaboration with the physician that they may talk to at any point if they need to, right?
Correct. It's a collaborative model. We have contracts with a number of nursing homes where our nurse practitioner will be there Monday through Friday, basically roughly 7 a.m. to 4 p.m. And so they're embedded daily in those facilities to be available for acute care services or other routinely planned exams.
And do they handle skilled care only? Do they handle Medicaid? Do they handle private pay? Is it everybody in the nursing home, or how does that kind of work?
We've specifically been in skilled nursing facilities, and we do bill the patient's insurances, which in our case is probably about 40% of the time Medicare. But we're an independent company and credentialed with all the other types of insurances that our patients have.
Nice.
So typically there is no charge to the facility for us to be there, and everybody benefits in that way.
Why wouldn't they do this, right? Oh my goodness,
Absolutely.
this is amazing. What a nice thing to have.
Yes, thank you.
So many nursing homes could use that extra set of professional eyeballs and wound care and whatever else it is that somebody.
Yeah, no doubt. We're able to treat people on site and avoid unnecessary hospitalizations. So that benefits the patients and the healthcare system in general. The payers have found that we're very much of a valuable asset to have in place.
Cost savings for them, true, and not having to move somebody in an ambulance to the hospital for just to check to see if they're okay. I mean, what a nice thing to have. So I love your model. That's awesome.
Thank you.
So tell us, what is the best thing about serving aging adults or serving this population that you found?
Yeah, well, we take satisfaction knowing that our work is somewhat restorative in nature. Even though we're treating people that sometimes are in some dire circumstances, we're able to bring wellness through meeting both acute needs and longer term issues. We intentionally chose the word hope to be part of our company name because we believe that's what we truly deliver. We're upholding the dignity of people, and it's nice to enjoy the ongoing relationships and the deepening of relationships that can unfold with us being there on a daily basis.
Yeah, absolutely. That's a great resource. It's not just in and out, it's there all day, getting to know those residents, being a part of their life every day. That's fabulous. Yeah.
Thanks.
Thank you. So what other successful leaders or mentors or organizations in your life have really meant a lot to you, maybe specifically to this or anything in your entrepreneurial life? What has led you to this, and who has been important to you in your life?
Yeah, well, I've got to give credit to my partner, Dr. James Gardner, the founder of Hope. Dr. Gardner is based in New Wilmington, PA, and he's been an inspiration from the standpoint of recognizing a need in the skilled nursing facility setting and doing something about it. He recognized the need for there to be daily care. He's had a passion for treating the elderly and being an expert in the field of geriatric care, and that passion rubs off on everybody in our company. So it's been wonderful to work with Dr. Gardner.
Very nice, very nice. It's always great to have for the passion and excitement to come from the top down, and to have someone who's really a great example for everybody in the company. That's always
awesome. It's one of the freedoms of entrepreneurship, I'd say, because that freedom of purpose and freedom of relationship, being able to apply our passions and skills to those things that really make a difference in life, and spend our time working with and alongside those that we respect and enjoy.
Yeah, absolutely. Absolutely. All right, so I'm going to switch gears a little bit. I ask everybody this question. Right now, we can't network together necessarily. We can't do big group fun things, happy hours. I know some people are still doing whatever they want, but generally speaking, we're not out there, especially for those of us in healthcare. We're very keenly aware of the how dangerous it can be to be in big groups. So online marketing has always been an important part, but now it's become more important. What has been your experience with online marketing? How are you reaching out to people who, or nursing homes or facilities? How are you doing that now?
Yes, well, one of the foundations of online marketing naturally is to have a functional website. And at the very least, the website needs to clearly communicate what a company does and share some sense of identity of who they are and what they do. In Hope's case, we seek to convey that we're delivering better outcomes for patients, their families, partnered nursing homes, and regional hospitals. And that can get a little complicated because it's many constituents. So yes, we seek to do that through concise copy, not being overly wordy. We use graphics and some icons as a visual representation. That's the type of strategy that we have with our website, and a means of communicating with people, whether it be a portal for inquiries to be received, the offer of free presentations to potential nursing home partners that would wish to partner with us, which then leads to things that can be shared in electronic means, presentations to be shared online. I'd also say social media can really demonstrate authenticity, in particular of service providers, whether it's through Facebook, Instagram, LinkedIn, maybe a channel like a blog. It's a platform to demonstrate culture. Ultimately everybody wants to earn the reputation of being a thought leader, but that's really required based on delivering content and value through social media. And one of the greatest pieces of advice that I've received in my career on the social media front is what a consultant called the rule of 14, being only 1 in 14 posted social media postings should be overtly self-promotional. The vast majority of it needs to be delivering value, content, things of interest to the audience, and not just us spouting off about how great we think we are.
Yeah, exactly. Yeah, you're right. I do. We run into that a lot. Everybody wants, in my other business, this is more of my creative outlet, but in our other business that we find that folks want every day there to be something that's an advertisement. And I say, that's another great way to run this. So we have to do a lot of educating. And the rule of 14 is a good one. I'm going to use that. What's the rule rule of 14. You only need to
Yes.
advertise about yourself once or once a week, twice a week maybe,
Mhm.
but you don't have to do it all the time. They're there.
Yes.
They're watching you for a reason because they trust you.
Well,
Um,
having that discipline to be consistent in the message and regular in the postings. I mean, it's certainly something that I aspire to. I've got to be honest.
yeah,
But regularity is key. And so whether it's something that is done hands-on or with a partner or an ally that can institutionalize it somewhat is very helpful.
sure. And let me ask you a question about your business model.
Mhm.
Um, I would imagine, I know nothing about this except from a nurse's perspective. Is your model, surely it's not the only model in the US that does this, or are you the only model that's doing this right now?
Well, at least in our area, there aren't many. And our area is Western Pennsylvania. There are one or two services that I know of that are very similar. In Pennsylvania, we have chosen to specifically employ nurse practitioners as opposed to physician's assistants, just because of the legislation in our area of how there's some advantages in the autonomy, a little bit greater level of autonomy
Mm,
that they can work with. Of course, we have two physicians on board with us that are collaborating physicians with our staff, providing the records review and oversight and being go-to people.
yeah,
But Dr. Gardner in particular has been influential on a regional and national level for different types of bodies that he's had leadership roles in.
good.
And that has led to us having some neat conversations with other groups in other states about
Yeah.
how they're doing it. So, I'd
Yeah.
like to think that we're helping to rise the tide
Yes.
in many ways.
Absolutely. I would think that this model, in some form or fashion, it may look different in every state, but some piece of
Mhm.
this model would be so valuable. Not only, whether it's coming from, Medicare or it's coming from an insurance company, just to promote the benefits of this. It seems like all across the country we could use models like this that would enhance the care and not rely on that once a week or once a month visit from a doctor and cut down on those ER visits. I think it's a fabulous model. I mean,
Yes, thanks. It's one of the things I'm proud of because
yeah,
we've been able to take some commonly accepted concepts in healthcare and actually be applying them and doing something and making the world better in our own
yeah,
way.
that's great. All right. So, what piece of advice would you give to other senior care providers?
Oh, well, we've mentioned collaborating.
Yeah,
And I'd say the word collaboration is used extensively in the world of senior care and in healthcare in general. But my advice is to do your best to really define the specifics of what that collaboration looks like on the front end of
mhm,
establishing service relationships. That's key because we we've we probably know or have experienced the shift of duties and responsibilities that occurs in the healthcare and senior care environment, and that's to be expected in many ways. But that leads to another piece of advice that I would offer is the need to have a balance between assertiveness and also maintaining a servant's heart.
yeah, nice. Very
Mhm.
nice. That's a good piece of advice. Maintaining a servant's heart. Yeah, absolutely. And that's what this show's about is how can we do better?
Mhm.
What business models exist that we didn't know about before, and how can we give each other some sound advice about what's worked for us and what we
Mhm.
think works best in the senior care industry. So thank you for that. And I have
Yeah.
one last question.
Okay.
All right, it's my fun one. When you haven't won in life or business, how do you like to celebrate? And that can mean
Oh.
anything. We've had a million answers, not a million, but lots of different. So I had a doctor pull out his bottle of tequila from underneath his desk and say, sometimes you just need a shot of this at the end of the day. He was a hospice physician, a
Oh
great
yeah.
guy.
Yeah.
But and I've had vodka martinis. We've
Mhm.
had jump in the ocean, dance, just have a nice dinner. So what's your favorite way to celebrate?
Okay. Well, in general, when it comes to celebration, I say that wins need to be shared. I mean, we all get a sense of satisfaction individually in what we do, hopefully, but it can get lost in the shuffle of everyday
Right.
life. So I'd like to see leadership having intentionality of bringing people together. And that's a challenge for us in the nature of our company being decentralized.
Yeah.
So, as I think back to some of the events that we've had, I try to mainly have our gatherings have a minimal business agenda.
Yeah.
And when we do, if it's a celebration, if it's a party, a holiday event, I've done some unusual entertainment types of things
Oh, nice.
in my career. I've hired a handwriting analyst to do
Ooh,
something
nice.
participative with our team. Yeah, some people found it insightful, some people found it comical, some people were a little insecure about it. I mean,
Yeah,
all of that made for
that's
a,
fun.
a
Yeah.
neat event. On another occasion, I brought in a ventriloquist
Wow.
to roast senior leadership,
Nice.
myself included. And
That's pretty funny. Yeah.
yeah, that went
Good
over
roast.
very well, except for maybe in the opinion of one of my family members, but that's another story. Uh,
That's always good.
well, yeah, but speaking of stories, storytelling is key
Yeah.
because when you go out on a limb to do something different, it may or may not go over very well, but either way, it's going to add a story to the lore of
Hmm.
a team of people that are working and living together, and the stories themselves can live on in terms of culture formation within the company, and also in demonstrating that authenticity that I talked about previously on social media.
Oh, trust me, there's plenty of lore in my company, typically revolving around me. Remember that time when you told us we all had to do this because this is a great new thing? And it lasted like 5 minutes. Yeah. So yeah, it
Yeah,
wasn't a great new thing. It was a hassle.
yeah,
And I
well,
realized it very quickly. But yeah, so no, I'm sure there's many tales of lore about me.
yeah, well, that's part of
But
the risk taking of leadership.
that's right. And I laugh right along with everybody else. It's I'm always good for a good roast. So anyway, but yes, absolutely. I think that all of that is good. Those are good ways to celebrate. And when we can get back together
Mhm.
and do a little celebrating together, all those things are. I love the hiring somebody to come in and do a little something different for a group. That's fun. That is really cool.
Thanks.
All right. Well, thank you so much for being on the show, for telling us about your business, and for telling us, sharing your wisdom with us. But that's what we're looking.
Thank you, Valerie. It's been a lot of fun, and I commend you in the work that you're doing to uh, get great ideas and strategies out into the marketplace.
Yeah, I think this is it was a great way to spread the word about all the crazy things that we do out there to help seniors and our passion for all of this, and it's been great. So thank you.
You're welcome. Take care.